Good evening. It's November 14th, 2011. I'm your host, Dr. Peter K.B. St. And I'm guest host for Dr. George E. Smith. Joining us today, we have Dr. Zahrain R. St, who will be talking, who's actually a family physician. She'll soon be introducing herself. And today we'll be talking about a very important quote we saw before in the Chicago Tribune here on January last year, January 20th, 2010. We will be talking about the issue of childhood obesity. There was a discussion here that related to First Lady Michelle Obama, and it says that obesity could be even a greater threat to Americans' health than smoking. And if the nation stays in its current path, nearly 50% of all Americans will be obese in 10 years. Not just overweight, but obese. We'll be talking to Dr. St. Jean. What is the difference between obesity and just being overweight? Why be so concerned about obesity in the first place? For us as parents, what should be our concern? How do we help our children against this epidemic? Dr. St. Jean, thank you so much for joining us today.
Thank you for having me. It's an honor.
A family physician, can you tell us, how did you prepare to be a family physician?
Well, according to my mother, I was probably about the tender age of 4 or 5 years old when I stated I first wanted to become a physician. So from that point on, she really helped to encourage and nurture me in that direction. I did some volunteering at the age of 14 at a local area hospital, Little Company of Mary. So that was my first foot in the door, beyond me seeing my own pediatrician for regular checkups. And once I finished high school, I graduated from Whitney Young Magnet School on the west side of Chicago. I went on to Xavier University of Louisiana in New Orleans, where I studied pre-med biology and received my bachelor's in science degree. And then I went on to Case Western Reserve University in Cleveland, Ohio, where I obtained my medical degree. So it takes 4 years of high school, depending on how long you take for undergrad, 4 to 5 years on average now, maybe 6 years for your undergraduate degree, and then typically 4 years of medical school. After that, you go on and do your residency training, depending on what type of specialty you want to do. I chose family medicine, which takes 3 years of training after your medical school training. So you become an MD, you are a doctor, and then you do on-the-job training, which I came back home here to Chicago and did my training through the Loyola Providence Cook County residency program, which we did part of our training at Providence Hospital on the south side of Chicago, as well as part of our training at the main county, now known as Stroger Hospital, and then also at Loyola University Medical Center in Maywood.
So that in total, how many years was that about? From college, first day of college?
I should know, 12 or 13 years.
12 or 13 years old. You know what? 12 or 13 years from now, you're going to be 12 or 13 years older. Why not have a medical degree, right? So why? There are different types of physicians. There are, in the field, we have family physicians, we have internists, we have surgeons. Why? Why choose family medicine?
Well, initially, as I said earlier, my first exposure was to pediatrics, so I probably thought I wanted to be a pediatrician. But once I learned about family medicine what it meant when I was in my first semester of medical school, I knew family medicine was for me. A family physician is someone who takes care of the whole family. And myself, I take care of patients from the beginning of life to the end of life. I deliver babies. I see the babies once they're coming for their checkups and their vaccines. I take care of moms and dads, grandmothers, grandfathers, the whole gamut. Right now, my practice in Blue Island, I see quite a bit of children and infants. Blue Island and the surrounding nearby Chicago area and Chicago suburbs, a lot of babies are being born. So
they are blessed with the gift of reproduction.
Right.
Dr. St. Jean is a board-certified family physician and practicing physician at Metro South Medical Center in Blue Island. She also services a lot of persons here in the city of Chicago. You're watching the Do's and Don'ts of Parenting. I'm your host, Dr. Peter K.B. St. Jean, sitting in for Dr. George E. Smith. Today we are talking about raising healthy children. We are particularly concerned with this issue of obesity. Well, just in case you're wondering, Dr. St. Jean's last name is not a coincidence. This is the woman that I've had the pleasure of being married to for almost 10 years. And last week you met Patrice St. Who was educating us about, something about parenting. And you do not see invisibly here my friend Marlon here on the telephone. Marlon learned to, he teaches us a few things. He teaches us about computers. We teach him about health and family and these types of things. But Dr. St. Jean, tell us, why is obesity such a big concern?
Well, obesity, it's an epidemic. It's a health condition that some statistics show that as far as children are concerned, it probably is at least 25 to 33%, or up to a third of children in the United States are affected by obesity. In the African American and Hispanic communities, the statistics are probably even closer to 40 to 50%. So it's a very serious condition. In the beginning of life, we may not see the seriousness of what obesity or being overweight, how that can affect a person. But what I see as a family doctor is as children become older, they develop diabetes once they're adults. They develop hypertension. They develop high cholesterol. They develop arthritis of the spine and the knees. They're not able to move around as well. Ultimately, they get heart disease. And heart disease is the #1 cause of death in the United States. So if we could prevent obesity, we could prevent multiple illnesses that lead to heart disease, diabetes, high blood pressure, high cholesterol, some of the things that I just mentioned. Some of these conditions don't even develop as adults. They develop sooner. We're starting to see something called type 2 diabetes. There are 2 types of diabetes, type 1 and type 2. Type 1 is something that genetically you're born with, and there's a problem with your body actually making insulin. But type 2 diabetes is something that actually is a consequence of being overweight. And in the past, prior to the last, I'll say 20 years or so, type 2 diabetes, by definition, you were over the age of 19 or 20. Now we're seeing type 2 diabetes, 12, 13, 14, 15-year-olds, because they are overweight. When your body has more adipose tissue or fatty tissue, you don't... your insulin does not work as well, and you cannot break down sugar or carbohydrates that form into sugars in your body as well, and that's what diabetes is.
Now tell me this. I can hear persons thinking about those complications and thinking, well, is it only obese people that are susceptible to those types of problems that you have mentioned? Because you mentioned that obesity is... But if we're talking about raising healthy children, is it only obese children that are at risk for those types of...
No, you can develop diabetes as an overweight child, or even someone who's not overweight, or hypertension. Some things are based on your genetic predisposition, what you were born with. But obesity is just something, or being overweight is something that can give you a greater risk for some of these things that you may already have a risk for.
So as a practicing physician, where's the line between an obese, someone who is obese, and someone who's overweight?
Well, it's a statistical type of thing. It's a numbers thing. By definition, if your body mass index, which is a calculation that we as physicians and or scientists determine based on your weight and your height, and the BMI determines your body mass index determines your risk for heart disease. If your BMI is 30 or greater, it's considered obesity. If it's between 25 and 29.9, it's considered overweight.
Okay.
So it's just a matter of a definition.
So it's not just a style thing. It's not just an issue that I want to look thin. I was talking to a lady the other day, and she was a little bit worried, and she was losing weight. And her friends asked her, why you keep losing weight? She said, I just want to look trim and sexy. But she said, I'm actually just worried. But there are a lot of issues about how we look. A lot of image, a lot of image issues, a lot of issues with self-esteem. So the issue of obesity, as we're learning, is not just a matter of aesthetics. It's indeed something that really deals with our health. We want to remind you to watching the Do's and Don'ts of Parenting. You can call in at 312-738-1060. And it seems that we have our first caller. Caller, thank you for calling.
Good evening. Hello?
Yes.
My question is this. When you're talking about the problems that some families may experience, don't you think part of the problem, and it may be overlooked, it may be a cultural problem as well, because some families, they look at certain dishes, eating a lot of maybe such things like pork and the starchy food. It may be just a matter of part of their culture as well. They're contributing to the problem.
Yes, that's a very good question, caller. Thanks for calling. Dr. St. John, do you have any advice for persons about nutrition? Because I agree. I'm from the Caribbean, and I'm not going to say I like pig feet because my Muslim brothers are probably going to be trying not to talk to me, shake my hand tomorrow. So I won't tell you if I eat pork. Well, I do. But the fact of the matter is some foods are too fatty, the chicken wings as opposed to the chicken breast and so on. But beyond just with some of us culturally, we do certain things. We were talking before about my trip to Oslo, and I saw the way when you go to Europe, the portion of foods that you get, the types of foods. And if we get a chance later on, I'll tell you some of the history of why we eat such horrendous foods for our system. We'll talk about that a bit. But what, as a practicing family physician, especially as we talk about children, what sort of guidelines and advice would you give for healthy diet? And it seems it's not just diet; it seems that there's also physical activity associated with that. What type of advice would you have for callers, viewers in that regard?
Well, I think the caller hit the nail on the head. It's so very true. What we put in our bodies from a food perspective is definitely cultural. Starting from newborn babies, for the first 4 months of life, it's recommended now from a physician's perspective that babies only take in breast milk. Breast milk is the best milk, and or formula if you need to breastfeed. If you need to formula feed or choose to feed by a bottle with formula, we try to make that as nutritiously sound as breast milk. But breast milk is really all that a newborn baby up until 4 months needs. However, I think some years ago when I was an infant, things were different, and I have parents who come in all the time telling me what their moms and their grandmoms are telling them to feed their baby when they're less than 4 months old. A baby under 4 months should not have free water unless it's recommended for certain medical conditions. We do encourage water, but generally all they need is the water that's in the formula or the water that's in the breast milk. In addition to that, they do not need rice cereal before they're 4 months old unless there's a medical condition. For example, acid reflux. Putting rice cereal in the milk can be helpful. After 4 months old, we do start introducing some solid foods. Usually I recommend my patients starting with vegetables first, the pureed vegetables in the jar form, or preparing them freshly yourself. And you try one new food per week, and then you go on to each vegetable that there is, and then you go on to the fruits, and by the time they're 6 months old, you may start introducing other things. And pardon me, I misspoke, but actually you start with the rice cereal or something like that before you go into the vegetables. By the time they're a year old, they're starting table foods. And this one, it becomes so very important culturally, what you introduce to them. You want to introduce healthy eating habits when they're starting to eat table foods, things that you know or that your doctor recommends to be healthy for your child. Culturally speaking, I had a patient in the office today, 10 months old, and I was giving my education about how much juice should or should not be given. And I said it should only be 100% juice if you give juice at all. And my recommendation generally is no juice is necessary. You can have fruit and a glass of water. That's the same thing as juice. But as far as drinking it, you don't really need to drink juice. And she said, so I guess that means soda is off. And I stayed composed and I said, yes, definitely, no soda. I don't recommend soda for anyone, whether you're 4 months old or 40 years old. Soda is just not a nutritionally sound beverage, and it's nothing that we need to help us to be healthy and to have a better quality of life from that perspective. And she said, well, sometimes we give him a little Pepsi or Coca-Cola. And I've heard that in the past. I hadn't heard it in some time. But nevertheless, to really answer your question, there's a tool that I do use in my office regularly now, and it's called the 5210 rule.
And you say 5210. We want you to remember that number. We're going to take a break and take a call from a caller. Remember that number, 5210. And when we come back from listening to the caller, Dr. St. John will explain to us what that means.
Nothing comes easy. You can do it today. You can do it somehow. Hang on till you